Research shows about 80% of a person's health is related to the conditions where they're born, live, learn, work, and play, also known as social drivers of health. Because of this, St. Luke's has a special team dedicated to connecting patients with resources to meet their needs beyond the walls of its hospitals and clinics. Thanks for joining us for this week's Health News You Can Use. I'm Lindsay Stish. Joining us today is Meredith Cantrell, the Program Manager of Community Health Initiatives at St. Luke's. Meredith, thanks for joining us.
Thank you for having me.
So first of all, can you briefly explain what types of things are considered social drivers of health, and why has there been an increased focus on this in the past decade?
Yes, so social drivers of health are really those non-medical factors that impact a person's health. So these can be things like access to food in our neighborhood, our access to transportation, the housing that we live in, and whether we have safe spaces to exercise within our communities. There's been a lot of emphasis over the last 10 years around social drivers of health because research is showing that these factors have more impact on our health outcomes than even the care that we provide within our clinics or our hospitals.
Wow. So patients are asked a list of questions related to this before or during their appointments, and some might wonder, why is my healthcare provider asking me these questions?
Yes, so at St. Luke's, we are really committed to helping address those barriers that might exist in a patient's lives that could impact their ability to access care or to achieve their full health potential. And so we ask these questions so we can really truly understand what the full picture is of a patient's circumstances, and then also sometimes we are able to get them connected to resources in the community to help meet those needs.
Oh, great. So what are some of those resources that are available to patients, and how can they access those?
So we really take an individualized approach to that, depending on kind of what the patient would like. So we have a lot of patients who want to self-navigate, and we have a website, stlukesresources.org. It's powered by Find Help, and it has thousands of resources in the communities that we serve that anyone in the community or patients can search that database. As part of our screening, we do also ask patients if they want assistance with their need. And if they say yes, we have community health workers that will reach out. They will meet with the patient either virtually or in person to really understand what might be going on with that patient, if they've been able to access any resources, and what resources might be available to them. To take that a little step further, we are very fortunate in Kansas City. We have a lot of amazing organizations that work in this space, and we have 11 of them that we collaborate with more closely, that we are able to, with the patient's permission, connect them to that community-based organization or social service agency to get them some resources.
Oh, fantastic. So one of those community-based organizations that St. Luke's partners with is Canby's Markets. Can you walk through how a patient might use Canby's resources as an example?
Sure. So Canby's Markets, we have been working with them in tandem for the last year to create a produce prescription program. Canby's is an organization that works to get fresh fruits and vegetables into communities where there's not a lot of access, and they make it very affordable. So they work with area gas stations and corner stores to place those produce stands. Through our prescription program, if a patient is positive for food insecurity and they have a condition that would really benefit from having access to that fresh produce, so it might be diabetes, hypertension, or obesity, we get them connected to Canby's. Canby's is able to provide them 6 months of vouchers to purchase produce. And then at St. Luke's, we provide them some coaching and support. So they work with our nurse care coordinator to get some healthy lifestyle coaching, recipes, and then with our community health worker as well to see if there's some other resources that we can get them connected to help with their food insecurity.
Sounds like such a great collaboration. What's another example of a community-based organization that St. Luke's collaborates with to provide other types of resources?
Yeah, so as I mentioned, we have 11 organizations that we work with, which are all amazing, one of which is Bishop Sullivan Center, and they've been able to really help some patients who have unique needs. So for example, if a patient has diabetes and they need to refrigerate their insulin and they don't have access to a refrigerator, they've been able to purchase mini fridges. And sometimes we have patients who are in need of home repairs, such as maybe they've been without hot water and they're able to get somebody out to help look at that hot water heater.
That's fantastic. Is there anything else you'd like to add or a final message that you'd like to leave us with?
Yeah, we've been screening now in primary care for about 3 years, and it's been really amazing to see the impact of asking these questions on our patients. Having this information really helps us fully understand what is going on and helps us truly partner with a patient to achieve their full health outcomes. We know that these are sensitive topics sometimes to talk about, and we're very grateful that patients have put their trust in us and are willing to share that information, and it really helps us meet their full health potential.
Wonderful. Well, thank you so much for joining us.
Thank you for having me.
To learn more about free or reduced cost services for medical care, food, housing, and more, visit stluke'sresources.org and enter your zip code to search community programs near you. You can also stay up to date with all the latest health news and stories from St. Luke's at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.